Hello, name is Dr. Jeff Harris. I'm a psychologist in New Mexico in the southwestern part of the United States. This video is going to be presenting key strategies training lesson 6, using behavioral strategies to explore actions. These slides were developed by my colleague Elizabeth Campbell several years ago when we worked together at Texas Women's University. So if you've watched these videos in order, we've already looked at cognitive therapy by Aaron Beck, emotion-focused therapy as described by Leslie Greenberg, and now we're looking at behavioral therapy, particularly Martel's behavioral activation. So this is lesson 6. So we've already looked at parallel strategies for exploration and change. We've looked at exploring and changing thoughts. We've looked at exploring and changing feelings. So today's lesson is exploring actions. Then we'll talk about changing actions. And then the last lesson we'll focus on using a multidimensional survey to choose a focal dimension. So behavioral psychotherapy focuses on actions and uses these behaviors as a point of clinical leverage to encourage multidimensional change. Behavioral strategies support effective actions or reduce maladaptive conditioned responses. So there's those two parts of behaviorism, both the behaviors that are more prevalent in operant conditioning and then conditioned responses, which is the focus of classical conditioning. So effective actions help people meet their needs, attain their goals, or avoid undesirable consequences. So obviously the flip side of that is ineffective actions don't help people meet their needs, don't help them attain their goals, don't avoid undesirable consequences, or use up energy without getting these needs or goals met. So in psychotherapy, when we use behavioral interventions, we want the primary impact to be to encourage effective actions. But in the multidimensional way that we've been talking about here in Key Strategies training, effective actions are likely to have a secondary impact on functional thoughts and adaptive feelings. So when we choose good actions, when we choose adaptive actions, that's going to have a positive impact on cognition and emotion as well. So let me tell you a little bit about behavioral activation. So Christopher Martel, Sona Demijan, and Ruth Herman Dunn wrote this book, Behavioral Activation for Depression, in 2010. I think there's a second edition out that's more recent than that. Behavioral activation is based on operant conditioning. It's tested by research, and it works as a standalone treatment, and it's action focused. We're not encouraging you to use it as a standalone treatment. We're encouraging you to work interactively with cognitions and emotions, but it is effective for reducing depression. And since then, it's been applied to other issues as well as depression. So the overall idea is that the job of the behavioral activation therapist is to engage the client in a careful and detailed examination of behaviors. So in this video, we're going to be describing 4 strategies for exploration. Behavioral strategy 1, focusing on actions. Behavioral strategy 2, understanding triggers, functions, and impact. Number 3, analyzing effectiveness, and behavioral strategy 4, discovering patterns of reinforcement. So the first strategy is focusing on actions related to clients presenting concerns. So the marker here is that when clients don't realize how their behaviors may be related to psychological problems, it may be helpful to focus on actions. So Martel and his colleagues said the job of the BA active therapist is to engage the client in a careful and detailed examination of behaviors. In order to facilitate focusing on behaviors, the therapist may begin by asking about what clients are doing. The therapist should try to understand clients' actions in concrete terms by breaking concerns down into small, manageable action points. So even if a client is avoiding something and saying, I haven't been going to my university classes, it's important to know, what are you doing instead? Are you playing video games? Are you watching YouTube videos? What are the actual actions that are happening? But when therapists focus on actions, it's expected that clients will gain insight into how their current actions contribute to and perpetuate negative thoughts and feelings. So here's an example of behavioral strategy 1. The client says, nothing is going right. I'm doing awful in school. I just want to lie in bed all the time and stay away from everybody. I miss my friends, but it's just too hard. And the counselor says, sounds like you're feeling so bad that it's making it difficult to do your normal activities. So what do you do instead? When you're laying in bed, are you watching TikTok videos? When you're laying in bed, how many hours are you sleeping? So the second behavioral strategy is understanding the triggers, functions, and impact of specific actions. And the marker for this one is that once a firm understanding of client concerns in behavioral terms has been reached, it is important to gather information about the antecedents and consequences of those behaviors. The context is that understanding the impact of client actions involves noticing what precedes and what follows important behavior. People are generally unaware of the connections interlocking various situations, activities, and feelings. Detecting such relationships helps guide the identification of the behavioral target of treatment. So in many behavioral traditions, this is called functional analysis. And so we'll be talking, what happens before, what happens after, and what is the function of a particular behavior. So here's a suggestion. In order to understand the impact of actions, the therapist may listen to the client's description of specific behaviors and ask about behavioral triggers. When does this happen? The functions, which is how do you benefit, and the impact, what happens next? So the consequences, by exploring the impact of actions, clients will likely gain insight into why they continue to act in ways that are incongruent with their desired way of being, and acknowledge secondary gains to their behaviors that they were previously unaware of or choose not to accept. So a secondary gain is not the primary purpose of the behavior, but another advantage. So if someone calls in sick from work, the secondary gain may be that they get attention. Oh, are you okay? I'm sorry, you're not well. So they may get attention. A child may act sick more if the secondary gain is that they get to stay home and one of their parents nurtures them. So here's an example. The client says, nights are the worst for me. I usually feel awful at night. And so the counselor wants to dig in a little deeper and says, what happens for you at night that makes you feel worse? Can you give me an example? And then the examples are going to flesh out kind of the antecedents or triggers, why the behavior occurs, and then the impact. So behavioral strategy 3 is analyzing effectiveness. And so the marker here is, once the impact of actions has been understood, it may be helpful to identify specific actions appear to be effective or ineffective, to identify which behaviors to increase and which ones to decrease. So once we've looked at specific actions, we're starting to see which are functional, which are dysfunctional, which are effective, and which are ineffective. So the context is that behaviors to increase include those that are likely to bring the client into contact with positive reinforcement in the environment. Behaviors to decrease are those that make the client's life more difficult or interfere with managing one's needs. Typically, these are avoidance patterns. So this goes back to a behavioral theory of depression, and that the behavioral theory of depression is that depression results from a lack of positive reinforcement and often is maintained by avoidance patterns. So we want to help clients understand the impact of avoidance patterns and overcome them, and to engage in activities that result in positive reinforcement and result in a higher mood. And that's for depression, but you can see how a similar pattern would happen for anxiety. So what leads to anxiety? How do you avoid that? And by avoiding anxiety, are you creating other problems? So the suggestion is to encourage the process of analyzing actions. The therapist may ask the client, what are things you do that seem to make problems better? What are things you do that seem to make problems worse? The consequence is that when actions are analyzed, it is expected that the client and the therapist will gain increased awareness into how particular actions are impacting the client. This phase of assessment is useful in treatment planning and prepares both the client and the therapist for subsequent interventions aimed at increasing effective behaviors and decreasing ineffective behaviors. So here's an example of analyzing effectiveness. The client says, I got ready to go to the party, but then I just felt too depressed. I felt relieved at first when I decided not to go to the party, but later I felt lonely. So the counselor says, sometimes we get stuck in the habit of doing things that make us feel better in the moment, but end up making us feel worse later, like avoiding friends. We're going to try to break those habits by replacing activities that keep you stuck with activities that help you. What are the things you already do that help you feel better? So one of the things that people do in terms of to get at that question, what are things you already do that help you feel better, is to keep track of activities and mood. So part of behavioral activation sometimes says you keep track of the activities that you do every hour and the mood. And it might say, watch YouTube, mood 20, watch YouTube, mood 20, watch YouTube, mood 20, walk the dog, mood 50. Watch YouTube, mood 20. So if walking the dog increases your mood over watching YouTube videos, then the therapist may encourage the client to walk the dog more frequently in order to engage in those activities that increase mood. So the fourth behavioral strategy in this set of exploration strategies is discovering patterns of reinforcement that shape current actions. Once behaviors have been described, it may be helpful to discover patterns of client behavior and reinforcement. So the context is therapists can identify avoidance by being on alert for behavior that helps a client keep something aversive from happening, to the extent that the behavior is likely to recur as a result of escape and avoidance. We can say that it has been negatively reinforced. So let's remember, from operant conditioning, negative reinforcement is when something aversive is taken away, and that increases the likelihood of the behavior, in this case, avoidance behavior. So let's say I'm invited to a party where my previous romantic partner is dating somebody new, and I realize that's going to bum me out if I see my old flame with a new partner, and so I avoid the party by not going because I don't want to be in that awkward social situation. But then the result is that I don't get to hang out with my other friends. And so that's and so then my avoidance behavior is reinforced by taking away the awkwardness of seeing my old flame with their new partner. And then as a result, I feel lonely because I don't see my other friends. So the suggestion is, in order to discover patterns, it's important that the therapist develop a sophisticated understanding of the client's actions by teasing out similarities and differences between behaviors. The therapist may differentiate between similar events by asking the client what was similar about this event and what was different. So we're looking for patterns, we're looking for subtleties. Why were you more comfortable in this situation than that? The expected consequence of discovering reinforcement patterns is that when patterns of reinforcement have been explored, it is predicted that the therapist and client will develop a more comprehensive understanding of client concerns and how ineffective actions are perpetuated. And here's an example. Client says, when you call in sick to work, how do you feel? The client says, I feel relieved at first, but later I feel guilty and depressed. So initially, it feels pretty good. That would help to explain why you call in sick, even if it causes problems later. So that's an example of looking at these reinforcement patterns that are there, but maybe subtle enough that clients aren't noticing them without your help. So those are the 4 behavioral strategies for exploring actions. In the next video, I will do a demonstration of those skills. So I hope you'll watch that demonstration as the next video, and we'll see you on the next video. Thanks a lot.